It's all about her, presented by Mariana's Physicians Group and Sago Maniago, celebrating 15 years.
Although gynecological cancers encompass a wide variety of cancers, the three most common are uterine, cervical, and ovarian. Sagua Maniago's Dr. Annie Berdalio and Dr. Ellen Bez take us through the signs and symptoms of each, starting with uterine cancer. This is the most common, and according to Dr. Berdalio, is becoming more frequent in younger-aged women that become overweight.
It's really, patients are getting it at a much younger age because we're finding young girls are overweight at puberty and they never get into that very regular cycle. And that's the number one risk factor for cancer of the uterus, having irregular periods for a long period of time. In the past, women gained weight after they left high school at 20, so usually uterine cancer was a disease of women in their 40s and 50s. More recently, we've had probably 4 or 5 patients in their early to mid-20s that have had their uterus taken out because of cancer of the uterus. And that's a problem because those patients were overweight at 10, and by the time they're 20, that cancer, so that's becoming a much bigger problem.
It's interesting to note that if you've ever been on birth control, which is actually a pack of hormone pills, at least 1 year during any point in your life, you've reduced your chances of ovarian cancer by 50%. As for cervical cancer, this particular cancer has seen a significant decrease in incidences because women are routinely getting a pap smear.
The pap smear has been incredibly excellent in detecting cervical cancer. I can't remember if the statistic was US or worldwide, but there's almost been a 75, probably US, decrease in the incidence of cervical cancer since 75% since the introduction of the pap smear back in the 40s, 50s. So it works. It's a great, simple test.
And studies have shown that instead of women receiving annual pap smears, it's now recommended that women get screened every 3 years. Now, of the 3 most common gynecological cancers, ovarian cancer is the most rare, and that's because it's not as easy to detect.
The symptoms are also very vague. You can have diffuse pelvic pain, bloating, weight gain, really not very good symptoms, very nondescript kind of symptoms in terms of your pelvis. So it's important to think about your risk factors. It's important to know if you have a family history, and if something's bothering you for a period of time, it's always better to get it checked.
The awful part of ovarian cancer is we don't detect it early. So by the time patients get it, they're already in the stage 3, stage 4 disease. And we think about the treatment for cancer of the uterus, cancer of the ovary as a chronic treatment. These are usually not curable, and they're more, but patients will be adequately treated for long periods of time. So the success rate at treating ovarian cancers and keeping it under control has become much better. So patients can expect to live still quite a distance, despite the fact that we only catch it when it's already advanced.
Bottom line, for any of these 3 cancers, if you notice anything unusual, such as irregular bleeding, then it's a good idea to look it up online and call your doctor.
Read, educate yourself. Look, come in with questions. I always ask my patients, you have a question list for today? Or, especially when it's an annual thing and things that have built up, and I tell them to mark it down, But when you're dealing with a cancer, look up stuff, read, get yourself as educated as possible, write down questions, things that bother you, bring them into your doctor. And again, this peace of mind thing is so important when you're dealing with a chronic and potentially, fatal illness. So the more you educate yourself, the more you read about it, the more you have questions, the better care you're going to get.
For more information, you can always give Sagua Maniago a call at 647-1830. Reporting for Guam's News Network, I'm Sabrina Salas, Matanani.
It's all about her, presented by Mariana's Physicians Group and Sago Maniago, celebrating 15 years.